Hi everybody, welcome to Education Week. This lecture happens to be on medications. My name is Michelle and I am very passionate about this topic because I happen to be a pharmacist. This lecture is going to be approximately 2 hours. And I tell you the objectives for today are 1, for you to understand your disease state and what you can do to help yourself, and 2, for you to understand your medications. So feel free to put any questions you have in the chat box. I encourage you to please put your initials, your first initial and your last name in the chat box so that we know who's attended this lecture. Keep in mind that Education Week is as important as the exercise part of cardiac rehab. And let's get started. So why do we talk about medications? Well, 1/2 of seniors, and we define seniors as anybody over the age of 65, has high blood pressure, and 3/4 of seniors have high cholesterol. So medications do work, and they can save lives if used appropriately. But if I was to tell you that 25% of hospital admissions or visits to emerge are due to medications, would you believe me? And that's true. 25% of admissions to hospital or visits to emerge are due to medications. Either the dose is too high, they perhaps are having side effects. But so understanding your medication is key. You can use as your resource your pharmacist, your local pharmacist, make an appointment with them. They do get paid to do a medication reconciliation. And I strongly urge you to do this before you go on holiday anywhere. As well, if you have any questions and you can't get through to your doctor or your specialist, certainly ask your pharmacist and they can fax a request to your family doctor or your specialist and they can help you answer some of the questions that you may have. So the #1 killer of Canadians, and we've touched upon this in other lectures, is heart disease. When you combine it with diabetes, which is 3% of Canadians die with heart-related problems due to diabetes. So what happens is diabetes is 3 disease states in one, and 80% of diabetics will die from heart disease. So when you combine that with heart disease as being the #1 killer of Canadians, that combination is what's going to kill the majority of Canadians outside COVID. When we talk about risk factors, do you remember me telling you that our most important thing that we talked about in lecture #1 is that 80 to 90% of your risk is modifiable and controllable by you? Well, some risk factors you are stuck with and you can do nothing about. And we said that in the first lecture. The fact that you age and that your cholesterol builds up over time. And remember me showing you this, that you're born with nice clean arteries and over time you end up with more cholesterol and plaque buildup inside your arteries. So age is an automatic risk factor, male is an automatic risk factor, and family history is not an equal factor. This is a doubling of risk. Now, these are the risk factors that you can do something about. You can do something about the fact that you have high blood pressure, diabetes, inactive lifestyle, high cholesterol, smoking, diet and weight control, and stress. There is an entire lecture dealing with stress and distress that we encourage you to participate if you haven't already done it. This was the most important, the next slide was the most important statistic that I gave you in that first lecture, whereas you can control 90% of your risk. And that came from the InterHeart study, which was conducted by a Canadian researcher, Dr. Youssef, out of McMaster in Hamilton. And this particular study was done in 52 countries around the world, and it showed that just by making modest risk reductions in some of your risk factors, you could control your risk of heart disease. Now, when you look, I asked the cardiologist, I said, people sometimes struggle when you give them so many things to fix, it's too much, it's overwhelming. So what can they do? Well, you can, and the cardiologist said, go after smoking and diabetes. Why? Diabetes happens to be abnormal blood pressure and abnormal cholesterol, which means it's taking care of factors 1, 3, and 4, and smoking would be the second thing he said that you must do. So those are the two things that you would look at addressing first. But certainly 90% of your risk is modifiable and controllable, and that is a very powerful thing for you as a patient to keep and hold true. Now, one of the things you see on here is that as late as the 1970s, 1 in 3 Canadians who would have had a heart attack would have died. But now, less than 5% of Canadians after a heart attack will die. But what ends up happening is that I'm going to reach for my model over here. And do you remember me showing you this on that first lecture? This baggy, saggy pump is what ends up happening. Your heart gets damaged, and that results in a weakened pump called congestive heart failure. And tomorrow you have a full lecture on that. And it's key that you understand what is heart failure, because this is something that does happen as you age. So what are the effects of doing things right? Well, if you just stick to taking your medications, you've decreased your risk by 64%. Well, that's fantastic. So if a physician prescribes your medication, if you take it, you've decreased your risk by 64%. But remember, medications only work if you take them. Now, if you make modest changes to some of those other risk factors, such as blood pressure and cholesterol, and doing some of those other things, what happens is you can decrease your risk by up to 90%. So what are the medications we hope to talk about today? We hope to talk about nitrates, antiplatelets and anticoagulants, beta blockers, calcium channel blockers, diuretics or water pill, angiotensin converting enzymes, angiotensin receptor blockers, cholesterol lowering agents, antiarrhythmics, vitamins, and then we're going to touch upon very quickly vaccines, and then we're going to open it up for questions. I ask that you hold your questions until the end of the lecture because it is a while for us to get through everything. So let's get started with nitrates. Nitrates are used to treat the symptoms of angina. And we've defined angina as being not enough oxygenated blood to your heart that results in symptoms such as chest pain, shortness of breath, nausea, and this is your warning that you may be at risk of a heart attack. So what we hope to use is nitrates to relieve the angina attack that's occurring. If you get an angina attack when you go out in the cold and the doctor tells you don't shovel the snow when it's -20, why? Because your arteries are constricting when it's very, very cold outside and they're getting narrower, and that results in angina. So you could use your Nitro Spray before you go out in the very cold. And it can also nitrates can be used to treat the number of angina attacks that are currently occurring, such as using a Nitro Patch. So how do we use a Nitro Spray? Well, I'm just going to get my little model out here. And for all of you, I want you to realize that in your Nitro Spray bottle, underneath at the bottom is an expiry date. So on here, this happens to be April 2022. So keep this in mind and realize that your Nitro Spray is going to expire, and get a refill done about 3 weeks or 4 weeks before. For most of you, your bottle is going to expire before you end up, before you run out. So when you want to use your Nitro Spray, the first dose, if you've never used it before or you haven't used it in more than 2 weeks, the first dose is off to the wind. You spray it to get it primed, and now it's ready for use. This is not a Ventolin, and you do not need to shake it before using. Spray once on your tongue or under your tongue, wait 5 minutes, and repeat if the pain persists. Every 5 minutes up to 3 times. Then you call 911 and go to the hospital. Now remember on the first lecture we talked about why you want to go by ambulance? Because you get seen faster and they start treatment en route. What can you expect when you use your Nitro Spray? You can expect to get a headache. Why? Nitroglycerin, what it does is it's a vasodilator, so it's opening up the arteries. And when it opens up the arteries in your heart, it opens up the arteries in your brain, and for most people, they will get a headache. For that headache, we strongly recommend that you use acetaminophen only, not extra aspirin and not NSAIDs, and I'm going to get into that a little bit later. The other thing that you can expect to get is lightheadedness or dizziness. And we had a patient in cardiac rehab that came and told us, well, when he used his Nitro Spray, he went from standing up to he fell down because he got lightheaded. So when you're using your Nitro Spray, if you can't sit in a chair, where can you sit? You've always got the floor. The idea being you do not want to fall from standing up to falling down, because then you could hurt yourself more. So keep this in mind when you use your Nitro Spray. Please, we want you to sit down before you use it. The next thing we're going to talk about is Nitro Patch. How do you use it? So Nitro Patch is similar to using an estrogen patch. It's individually wrapped. So you remove it from its packaging. It is a clear disc. You bend it in half, you'll hear a snap. Remove the clear plastic backing off. Apply the sticky side to one hair-free area, and then remove the backing and pat it down. We want you to wash your hands, because if you get nitroglycerin on your hands and then you eat, you're going to give yourself a headache. Remove the patch 10 to 14 hours after. So you do need a nitrate-free interval. So if your angina occurs during the daytime, you put your patch on during the daytime. If your angina occurs overnight, you put your patch on overnight. There is something to be said about angina occurring overnight, because a lot of heart attacks do happen at 4 in the morning or 5 in the morning when you get your cortisol shot. Now, when you remove your patch, fold it onto itself and then put it into the garbage, because a lot of little critters get into the garbage and you will give them a headache. Now, I can see the thoughts going on in your head going, well, is that such a bad idea to give those little raccoons and little cats and dogs a headache? And you're going, well, not probably a good idea. So remember to fold it onto itself before you put it into the garbage. We caution you with using erectile dysfunction medications such as Viagra, Cialis, and Levitra with nitrates, because they can cause an unsafe drop in blood pressure. So you may be saying, well, Michelle, I'm not using a Nitro Patch, I'm only using the Nitro Spray. So why can't I use Viagra? Have that conversation with your specialist or your family doctor. But the idea is you're not supposed to overlap for at least 4 hours. If you ever end up going to emerge, we need you to tell them that you have used an erectile dysfunction medication, because it causes a plummeting of your blood pressure if you use both nitro products and the erectile dysfunction medication, because both are vasodilators. So you bottom out your blood pressure and you do not perfuse your heart and your brain as much, and it can precipitate a cardiac event or a stroke. So remember, have that conversation before you use the erectile dysfunction medications. So I want you to put up your hand, and I know you're doing this virtually and you're going, I'm sitting by myself, but okay, put up my hand. Put up your hand if you happen to be using one of these medications, and I'm going to make a list of them. So put up your hand if it's on your current list or on your medication card or in one of your bottles. Are you using aspirin or acetylsalicylic acid, clopidogrel or Brilinta, ticlopidine or Ticlid used mainly in strokes, ticagrelor or Brilinta, prasugrel or Efavant, dipyridamole or Persantine used mainly in strokes, Coumadin or warfarin, dabigatran or Pradaxa, rivaroxaban or Xarelto, apixaban or Eliquis, or edoxaban? If you are on one of those, put your hand up. Now, what this diagram is called a forest plot, or it happens to be a meta-analysis. And what that is we put multiple studies together to explain to you whether or not the intervention or taking the medication is beneficial. So anything left of the line of unity, which is at 1, anything left of it means that the medication or the intervention was beneficial. And in all cases, When you see all trials and you see that open diamond shaped at the bottom, 22% in all cases, the idea of using a blood thinner is beneficial in preventing a heart attack, stroke, and death. And what a heart attack, stroke, and death is called MACE, major adverse cardiovascular endpoints. So what a cardiologist cares about is body bags or cardiac events. He doesn't care so much that you're getting a headache or minor side effects. That is important to you, but it isn't going to save your life. So it's, does it prevent a heart attack? Does it prevent a stroke? Does it prevent death? The major things that are going to happen to you. And what they found is that 50% reduction in having unstable angina or heart failure, and in all trials, a 22% reduction when you use a blood thinner. So let's start off with aspirin. Aspirin is the trade name. It also is Entrophin or Novacin, but there is a generic name that is called acetylsalicylic acid. And that is a name that's used in multiple countries. So aspirin can be sold by Bayer, or it could be sold by Shoppers Drug Mart, or it could be sold by Novo or Apotex or different companies. And that's the trade name. Whereas acetylsalicylic acid is the generic name. And you could buy multiple types of that one. Aspirin is used for many things, including relieving pain, reducing a fever, though we shouldn't use it in anybody less than the age of 18 because it can cause a very rare syndrome called Rye syndrome. So aspirin is not meant for any child less than the age of 18. But why you're using it is that it is an irreversible antiplatelet, and it thins out the blood and lessens your chances of a heart attack or a stroke. So you're using it as an irreversible antiplatelet. It comes in many strengths. So when you go to the shelf and you go to buy something, there is an 80 milligram and 81 milligrams. So 80 milligram tends to be in Europe, 81 milligrams, 325 and 650. The cheapest is 325, but you want to use the lowest effective dose. So if you were to look at your bottle, all of you should be on 81 milligrams, and the type that you're getting is the enteric coated so that it protects your stomach. Aspirin is used to prevent harmful blood clots. You're advised not to take any extra aspirin or ibuprofen or an entire class of medications called NSAIDs when you're on aspirin. Why? This class of medications is related to aspirin, so it's kind of like the cousin of aspirin. And it's not like taking one is good and two is twice as good. You don't want to overlap because it can cause stomach ulcers. So you don't take extra doses. That's why I don't like that commercial that comes on TV that says, if you think you're having a heart attack, take an extra aspirin. Well, that's not a good idea. You should call 911 first and let them tell you to take an extra aspirin before you take it. Aspirin should be taken with food. So if you don't eat breakfast first thing in the morning, I strongly advise you to take aspirin with dinner, because a lot of the heart attacks that do happen at 4 or 5 in the morning. And if you take it with dinner, it's closer in time, but aspirin does affect the entire life of the platelet, and it is effective for 24 hours. So it's more important that you take it than not. And remember to take it with food. So within the first 24 hours of you having a heart attack, you are more likely to have another heart attack, stroke, or die. And that is the reason why you go to the hospital when you have a heart attack. Why? Because essentially you want to be treated in the hospital to prevent that further arrhythmia. And that's another reason for you to go by ambulance and not have a family member drive you, because while en route to the hospital, something else can happen to you. You panic, then the driver panics, and and you could result in an accident. So in the first 24 hours, you're put on a second antiplatelet. Typically it's called Plavix, and it reduces your chances of having another major cardiovascular endpoint by 34%. So that is the reason why, if you think you're having a heart attack, call 911 and go to the hospital. The second time you're using another antiplatelet, is when you have an angioplasty or a PCI or a stent. So what is an angioplasty or a stent? It's metal scaffolding that is keeping your artery open, and it's a procedure that you start off with a catheter that goes from the groin or from the radial artery threaded back to your heart, and it's looking inside your arteries for narrowing, and it puts a metal scaffolding in there. Well, when you get an angioplasty, because you've introduced a metal inside your artery, your body does not like it. It's not the brightest duck in the pond, and it says, uh-oh, I've got a problem here. There's metal inside, so it's going to send platelets to clot it off. Get it out of there, because it thinks it's something foreign in there. And that's the exact opposite of what it needs to do. If you've got a stent in there, the idea is to keep the artery open. So if you have a DES or drug-eluting stent, you basically will be on 2 antiplatelets for at least 1 year. If you have a BMS or bare metal stent, you will go on 2 antiplatelets for at least 3 months, ideally up to a year. If you don't know what type of stent you have, you can ask the cardiac rehab team members, or you can look on your report card and we can tell you what type of stent you have. So the second antiplatelet we're going to talk about is clopidogrel or Plavix. And this is a prescription medication that is an irreversible antiplatelet. It comes as 75 milligrams and you use it once a day with or without food. You use it in a caution with a history of bleeding, and the doctor has weighed the benefits and the risks before prescribing it to you. Always check with your doctor or pharmacist before using any extra aspirin, ibuprofen, or NSAIDs. So this group of medications that I refer to as NSAIDs are non-steroidal anti-inflammatories, and they are over-the-counter medications that you can buy in a pharmacy for pain. And there's about 10 different types. That's why I say to you, when you go to the pharmacy, before you take something off the shelf, ask the pharmacist, I'm a cardiac patient, I've been advised not to take any NSAIDs, which one can I use for pain? So these include things that you're not supposed to use, things like ibuprofen or Voltaren or Toradol or Ketorolac or indomethacin or naproxen or ketoprofen, but there's an entire group of 10 of them. And the pharmacist knows which are NSAIDs, so they will tell you you can't use this for pain. So keep this in mind. Because you're a cardiac patient, you can't just grab anything off the shelf and says, well, I saw that commercial on TV and it says this works for this. Now that you're a cardiac patient, there are drug interactions, so that conversation with that pharmacist, with your pharmacist, is even more important. So clopidogrel does cause some side effects, and I ask you, when you get that handout from Shoppers Drug Mart, please don't read the entire thing, because if you read it, you'll be too scared to take the medications. Ask them what you need to watch out for, and before starting or stopping any medication, certainly when you start a medication, realize the first couple of weeks you're getting used to things. So keep that in mind, and if you do get some side effects, ask the pharmacist, what is it that I can do? But give yourself time to settle in before you decide, not for me. The second medication we're going to talk about that's an antiplatelet, that is the brother or the sister to Plavix, is Brilinta or ticagrelor. So they compared it to the gold standard of clopidogrel and said, in the event of a stent, and I can't use clopidogrel, what else can I use? So they compared it to clopidogrel, and they found that ticagrelor was better than clopidogrel at preventing heart attack, stroke, and death. So the MACE endpoints. The one problem with clopidogrel is it does cause a perceived, it's more a psychological shortness of breath rather than an actual shortness of breath. So if you did a spirometry, you won't find any difference in the results of the spirometry versus before. But sometimes people do perceive a shortness of breath when they're going up a flight of stairs. And over time, for most people, this does go away. The other antiplatelet that you can use is prasugrel. So keep in mind that prasugrel was, when compared to clopidogrel, was found to be more effective, but it caused an increased risk of bleeding. So now the first antiplatelet would be aspirin. The second one would either be Plavix or Brilinta. It would not be prasugrel, generally speaking, in North America or in Canada. We're switching from blood thinners, from antiplatelets now to an entire group that's called blood thinners or oral anticoagulants. And the first one is warfarin or Coumadin. And the other name for this is rat poison, actually. So what this does is it affects factors 2, 7, 9, and 10. And these are clotting factors, and they're dosed based on a blood test that you go to the lab or a point of care device that's called INR. And they test you in the morning and they tell you to take your dose at 6 o'clock, and they adjust your dose based on the level of your INR. So Coumadin is used to prevent harmful clots. With this, there are several medications, up to 1,000 medications that interact with Coumadin. So before taking any extra aspirin or Coumadin, or before starting or stopping any other medications, within 3 to 5 days, you have to check your INR. Now, Coumadin does interact, I mentioned, with 1,000 medications, especially antibiotics and commonly used medications. So remember to get your INR checked. It is very important also, it's not just medications that interact with Coumadin, it's also diet. So it's important to keep a steady diet of your vitamin K. And you'll say, well, what's vitamin K? Well, this is the leafy green vegetables that you tend to eat in your day-to-day life, but you can look up what your vitamin K foods are. And basically you need to be consistent. So we don't suggest you go from Atkins to vegetarian, where one is you're eating only meat and the second one is you're eating only vegetables. The idea being you have a consistent, balanced diet, and that you eat maybe a salad every day rather than avoid it completely. Now, initially, when you're checking your INR, you're checking it maybe twice a week, then you go eventually to once a week, then you go to every 2 weeks, and then maybe eventually you're doing it every 4 weeks. But unless you're taking medications in between and you need to adjust your dose. So Coumadin or warfarin is a medication that pharmacists, it's one of 4 or 5 drugs that pharmacists get very concerned about, and they keep very close tabs on you. Coumadin does interact with a lot of herbal medications. And as much as 70% of Canadians use herbal medications and don't think they should tell their specialist or their family doctor. So when we talk about ginger or garlic, we're talking about the pill format where you have 8 cloves of garlic all in that little pill, instead of just garlic mainly in Italian food or something like that. Herbal medications and also can come in pretty little flowers and plants. So if you ever see that Faculty of Pharmacy that's located at Kitchener and in Kitchener at University and Victoria, it's that beautiful building that has pretty plants on it. And you're going, what are those plants about? Well, those are drugs that are actually found in your garden. So digoxin's a pretty little purple flower, and ginkgo biloba is a pretty little flower that you can find in your garden. But all of these also can be used as medications. So I caution you in adding little herbal things to your regimen of pills before having that conversation with your specialist or your family doctor. So if you add turmeric to your medications, not like the dietary turmeric into your cooking, but pill format, it can interact with some of your blood thinners. So keep in mind, you don't get to take any medications off the shelf. Talk to your pharmacist or doctor before you grab those over-the-counter things and herbal medications, and discuss all your medications, including your non-prescription ones, with your physician and pharmacist. So when do you know your dose of Coumadin is too high? You're checking your INR frequently, and then they tell you how frequently you need to check it. But if you have unusual bruising, now if you bump yourself, you are going to have a bruise. But if you don't even bump yourself and you have this big whopping bruise on your leg, okay, well, maybe get your INR checked, because you will get extra requisitions. If you have any nosebleeds while on Coumadin or another blood thinner, we call them, unfortunately, nuisance bleeds. And it doesn't mean they're going to stop the medication. It just means you need to learn how to manage it. Back pain, well, you need to mention something. Black tarry stools could be a bleed in the stomach. So that means it also occurs when you go on iron after a bypass surgery, if you're on iron supplements. So if you do have black tarry stools or coffee ground vomitus, take a picture with your smartphone and show it to your family doctor. It may mean you're at risk of a bleed. Unusual bleeding from the gums could be gum disease. Blood in the urine is a problem. So if you think you've got any of these symptoms, you may want to get your INR checked to see that it's in the proper range. Typically the range is between 2 to 3. You want it closer to 3, like around 2.5, rather than under 2. Under 2 means your Coumadin is not being effective in preventing your risk of a stroke. People don't like to use Coumadin, so they've developed an entire category of medications called oral anticoagulants. And the first one out was dabigatran or Pradaxa. And the idea being, why were you using a blood thinner? One of the reasons is if you've had valve surgery, you would always be on Coumadin, unless there's more data out that comes out. But you would use dabigatran if you have atrial fibrillation. And do you remember me on our intro lecture talking about ideal heart rate is 60 beats per minute. So the heart is pumping around 60 beats per minute. And typically it could be lower if you're on certain medications. But if it's very high, like 150 or 200 beats per minute, and you are in atrial fibrillation or you're having an arrhythmia, you end up being at higher risk of developing a clot in your atrium, and the easiest path for the clot to go is straight up to the brain. So the idea being, you want to prevent the harmful clots that result in a stroke. That's why you can use an oral anticoagulant. With oral anticoagulants, when compared to Coumadin, they're more effective, even at the lower doses, and any blood thinner can result in a bleed. And the worst bleed is the bleed in the brain, but all of them, compared to Coumadin, are less than Coumadin. The one side effect we warn people about is heartburn with dabigatran, and it is a medication we use twice a day. So it is as effective or more effective than Coumadin or warfarin in atrial fibrillation. It has a lower risk of bleeding. It does cause more stomach irritation. There's no need to check your INR, but it is more expensive. So if you don't want to use, if the doctor hasn't prescribed that oral anticoagulant of not Coumadin, not dabigatran twice a day, he or she may prescribe Xarelto, which is used once a day, and when compared to Coumadin is more effective. Or they may prescribe Apixaban or Eliquis, which is twice a day. And when they've done studies, all of the studies have shown with the oral anticoagulants that there is a decreased risk of stroke or throwing blood clots, a decreased risk of bleeding, and a decreased risk of all-cause mortality. Now, we're switching classes of medications completely. So give yourself a nice big stretch. And we're talking about a class of medications which in 2003, the HOPE study was conducted out of McMaster University by, again, that cardiologist, Dr. Youssef. And it was a study done around the world that showed, despite any other medications and lifestyle changes, a new class of medications called ACE inhibitors, angiotensin converting enzyme inhibitors, decreased the risk of a heart attack, stroke, and death, MACE, by 25% up to 40. And this was seen regardless of any other drug the patient took or any other lifestyle changes. So this is a new medication prescribed to people with heart disease. And what is it? It's the prils. So if you put up your hand if you happen to be on perindopril or Coversil, ramipril or Altase, Turandopril or Mavic. So if you happen to be on a pril. And where do these medications work? Well, they're used in high blood pressure and in congestive heart failure, which was that weakened pump, and they're used to reduce the risk, or they're used in patients with heart disease or diabetes and atherosclerosis. It is acting actually on your kidney. And you're going, but I'm here for my medication talk on heart disease, and you're talking to me about a drug that works in the kidney. Do you remember me talking to you on your first lecture and said drugs that work organs talk to each other through hormones. So this hormone that is released during immense stress, such as a heart attack, or I'll give you the example, fight or flight. When you are under immense stress, for example, and I'll use a story, that you're being chased by a dinosaur. If you're being chased by a dinosaur, you got to run fast, because if you're the last person caught, you're the one eaten by the dinosaur. Great if you're being chased by a dinosaur, because you have to run fast, so your heart rate goes up, your blood pressure goes up, you start reabsorbing your sodium. That means you reabsorb your water, you don't stop to pee, and you run. Well, great if you're being chased by a dinosaur. Bad if this goes on long term. So when your heart is damaged, it's not pumping effectively. So these hormones are trying to get it to pump more effectively. And those hormones can result in you adversely remodeling your heart. And that's what angiotensin II is doing, is it's changing its heart, and it's resting the heart, and it's making it pump more effectively by affecting both blood pressure, heart rate, and fluid balance. So the ACE inhibitor, which acts on your kidney, has some side effects. It can cause a cough in up to 10% of people. And this cough is a dry, hacking cough that unfortunately in some people goes away, which is great because you want to use this drug. But in some cases, it gets really bad and people wake up in the middle of the night with a dry, hacking cough that doesn't seem to work with cough medication, lozenges, or anything. And it can get them incontinent. And they go into coughing spells where they get incontinent and they get very embarrassed by it. So if that happens, the doctor can change their medication to the next class of medications called an angiotensin receptor blocker, or they can change them to another ACE inhibitor. This class of medication also, when they block the sodium reabsorption, so that the water also gets pushed out with the sodium in the kidneys, it can result in potassium being reabsorbed. So potassium, this is fantastic electrolyte that works between 3.5 and 5. So if it's below 3.5, you get arrhythmias. If it's above 5, you can get arrhythmias. So you get blood work done 10 to 14 days after you start this medication. So that's why when you talk to a cardiologist and they prescribe medication, they give you blood work requisitions, because one of the things is the doctor wants to see benefit but do no harm. So they're looking to see that you don't get into trouble. So make sure you do your blood work when you're supposed to. This is a class of medications that you cannot get severely dehydrated. And you're going, what does that mean, Michelle? It means that if you are throwing up, or you have a bad flu and you're throwing up and you've got diarrhea going out the other side, so you've got the stomach flu and everything is coming out of you, but nothing is going into you. So every time you take in a glass of water or take a few sips, you just throw up. You have to hold this medication. So keep in mind, this is a class of medications that you have to hold, and it's in the category of SADMANs, which I'm going to discuss with the diabetes lecture. What can you expect in terms of side effects? Well, the first dose of an ACE inhibitor should be taken at bedtime. Why? It's going to drop your blood pressure initially, and it drops it a lot, so you can be fairly symptomatic. So why do we suggest we take the first dose at bedtime? Because if you're horizontal, you're less likely to feel a drop in blood pressure, and you just go to sleep, and in the morning you feel better. So when you start a new medication, especially this one, you want to ideally start it at bedtime, because I use the term dizzy Lizzy, that you can get a little lightheaded and dizzy. And it takes about 2 to 3 weeks to adjust, and then you can move it up earlier in the day if you want to. It can cause sometimes a headache. Captopril can cause a taste disturbance. But I want you to know the difference between a side effect and an allergy. So no problems if you've got nausea, vomiting, diarrhea. Well, we can adjust those things. We can give you other medications. We can figure a way to solve that. But if you develop a skin rash, hives, breathing problems, or anaphylaxis, that's an allergy. So if you have an allergy, you're not supposed to take the medication again. So talk to your pharmacist or doctor. If you've got any of those things, you hold the medication. So one of the things that can happen 1 in 1,000 is they develop angioedema, which is a swelling of this area here. But it is very, very rare. So if that does happen, call somebody before you take the next dose, and don't take the next dose without talking to somebody. So if you can't take the ACE inhibitor, another medication that also works on that hormone, angiotensin II, is the angiotensin II receptor blocker, or the sartan, such as olmesartan or Olmetec, valsartan, which is in Diovan or Entresto, which is a heart failure medication, or Atican or candesartan. So it's a sartan. So angiotensin receptor 2 blockers are used in high blood pressure and a backup to the patients who can't tolerate an ACE inhibitor. They're blocking that bad hormone in the kidney that affects blood pressure and your blood pressure and heart rate, and it's causing you to bring up sodium. It's pushing it out, and that's way it's decreasing your blood pressure. It also can increase your potassium. So very rarely, unless you're seeing a nephrologist, would you be on both the angiotensin blocker and the angiotensin receptor, the ACE inhibitor and the angiotensin 2 blockers, because both of them can increase potassium. So having said this, you're going to get blood work requisitions. Make sure you get them done. Now, you can get your own blood work checked and you can get your results back to you. During COVID, the concern is, should I be going to a lab? Well, you can make an appointment and just go there, and they usually will give you an appointment when it's a quieter time. As well, you can pay $25 and have the lab tech come to your house to get your blood work done if you're very, very concerned, but that is an additional cost. What can you expect? Angiotensin receptor 2 blockers are fantastic for side effects. So very few side effects, but again, first dose probably taken at bedtime. And it's really, they're more tolerable to you than the ACE inhibitor because it doesn't cause that cough or angioedema, which is that swelling of the throat. Now, adult learning principles say you can take in about 20 minutes before you tune out. So we're gonna have you do a big stretch right now, okay? So I want you to get up, 10 seconds, and do a big stretch. Now, because you're at home, I don't care if you're walking around and listening to this, it's perfectly fine. So nice big stretch, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Okay, so new class of medications. They're called the statins. And for over 15 years, we've known statins, on top of diet and lifestyle, proved to be an important part of reducing heart attack, stroke, and death, MACE, by over 55% with the second generations. These drugs have been studied in over 1 million people worldwide in all areas of cardiovascular disease and people who are at risk of heart disease. And they've been shown to decrease the chances of you developing a heart attack, stroke, and death by over 30 to 50%. No other medications have been as well studied. They are extremely safe, except for one side effect that occurs 1 in 10,000. And I'm going to tell you about that. So what is that 1 in 10,000? Well, it can occur in any time. So what is that chance? That's your chance of winning a lottery. So if any of you are on this call or watching this webinar and living in Cambridge or this region, you have not won the lottery. Because if you've won the lottery, you're living someplace warmer and nicer. So having said this, the likelihood of getting this one side effect is very, very rare. In this practice at Cambridge Cardiac Care, the cardiologist has had only 3 patients in over 50,000 that have developed this one rare side effect. Number needed to treat to save 1 life or to prevent an event is between 3 and up to 50. So keep in mind, it is a very, very safe set of medications, and it is very, very beneficial for you. So what are the medications? They are the statins. So the statins include atorvastatin or Lipitor arcaduate. It's in combination. Rosuvastatin or Crestor. Those are the second generation medications. The first generation of the simvastatin, simvastatin, lovastatin, pravastatin, fluvastatin, and they cause a 35% reduction in your LDL or your bad cholesterol. So how do statins work? Well, they lower the level of cholesterol in your blood, and they work on your liver by inhibiting the enzyme HMG-CoA reductase. Statins can interact with other medications, especially grapefruit juice. So grapefruit juice, I have a whole medications that interact with, that interacts with grapefruit juice. Hold on one second here. Big long one here. Okay, well, it's somewhere in here. But anyways, 4 pages of medications that all interact with grapefruit juice. So I would say to you, no problems eating oranges, just give up the grapefruit, okay? Because if it's not atorvastatin that's interacting with you, it's going to be another cardiac medication or another one. So the grapefruit is probably something that you would have to give up while you're on cardiac medications. What can you expect in terms of side effects? Well, muscle pain occurs fairly routinely, not the very, very painful kind, but achy can be normal with statins, and that's okay. Blurred vision, well, that's probably a problem and you should say something. Weakness or tiredness, well, it's likely your beta blocker. Unusual fever, well, that's something that you probably should say something to your doctor about. So regular blood work with a statin is key. And what we're looking for is blood work done at 10 days to see that it's safe with you and that it's not affecting your liver abnormally, and then at 6 weeks. And the reason we do this blood work is that it takes your statin up to 6 weeks to be effective. So if you had your cholesterol checked right after your heart attack, well, you weren't on your statin, so we don't know what the effect of the cholesterol was until 6 weeks later. And the reason I tell you it takes you 6 weeks is because some people do their blood work to please their cardiologist. They don't take their medications routinely, and right before they start exercising and they'll take their medication regularly, and the doctor clearly knows that the patient is taking their medication sort of irregularly. And you say, how do you know that? And that's because your statin's going to drop your LDL by at least 50%. So if your statin your LDL has been under 1.8 for the last 5 years, and all of a sudden it's at 2.5, the doctor's going to be saying, Mr. Smith, are you taking your cholesterol medication routinely? And you're going, yeah, doc, I'm taking it. And the doctor's going to be smiling at you, knowing you're lying to him or her, because you've just been taking it for the 10 days before you did your blood work. And before that, you weren't taking it. So keep that in mind. It takes 6 weeks for your cholesterol to fully lower your LDL, and you have to take it every single day. So I normally suggest you can take your statin. Dinner time would be great because the majority of cholesterol is synthesized at night. And I would say to you, no Canadian goes to bed hungry. You could fast in the morning, you could do whatever, but even if you go to a party, you're going to eat dinner. So if that's the case, take your medications with dinner and you won't forget. If you take it at bedtime, are you really going to get up out of bed if you forgot your statin? Oh, it's to prevent my heart attack or the next cardiac event. I forgot it. I'm just going to stay in bed. Okay. If you want to take it in the morning, that's great. So it's important to take your statin every single day. So put it with a meal. Now, the other thing they're checking is CK with it. So CK is your muscle enzyme. And remember me telling you that there's one side effect that it can occur at any time, but it's just this 1 in 10,000. So number needed to save a life or a cardiac event is between 3 and 50. So 3 people in the room, all 3 of us on it, 1 cardiac event saved. Well, that's fantastic. But number needed to develop rhabdomyolysis anytime during your statin use is 1 in 10,000. You are not that lucky to win a lottery. So please keep in mind, if you are achy from head to toe. Feel like you've been run over by a truck and your urine is brown, not yellow like what do you call it? Taking a multivitamin, but like dark brown, very, very concentrated. You want to call your doctor or your pharmacist, and you may need to go to get your blood work done. And they're looking at your CK. CK is your muscle enzyme. So if you get muscle breakdown, then we're concerned. But how will you know? You're basically your muscle from head to toe. So if you start to break down muscle, you will feel like you're achy and miserable all over. You will be complaining. That's when we need you to go to emerge. And that is why it's so important we have a second phone number and an email address to reach you, because if we can't get you and your CK is in the 10,000, we're going to send out the police to your house to find you. And then your neighbors may say something and you'll be very embarrassed. So the easiest thing for you to do is give us an alternate phone number. I mean, there's one so you can say alternate phone number or one in an emergency. If two people live in the same house, don't give us the same phone number because it doesn't work. If we can't reach you, we can't reach that other person as well. Now, we had a person go on a holiday and had elevated potassium. So we were very worried. And I happened to be the one looking at the blood work because the nurse was away. And I called the patient every single day. I looked at it and said, can you please give us a call back? Patient comes back from holiday, so does their blood work, goes on holiday, doesn't take their phone, no way of reaching them. They come back and they're very angry. You left me 10 messages on my answering machine. Okay, did your family doctor also call you? They did. We called you because your potassium was very elevated. We were worried and we didn't know how to get a hold of you. So if you're doing blood work, do not go on holiday the next day. The next thing also to keep in mind is if you have alcohol, do not get your blood work done 2 to 3 days before because your liver enzymes are going to be elevated, in which case we're going to start to lower your statin. And all it is you drank alcohol. So I would say to you, if you're going to get your blood work done, do it like Tuesday to Thursday. And if you're going to drink, you could start Thursday night and maybe have a glass of wine on the weekend. But do not drink 2 to 3 days before you get your blood work done because your liver enzymes will be elevated due to the alcohol. And if that happens, your statin gets reduced. Now, we look at LDL first. And do you remember me telling you in your first lecture, we wanted your LDL to be less than 1.8, less than 1.4 saves 2 lives for every 100 people. Even lower than that in the blue zones, as low as we can get it. So if you've had multiple heart attacks or your LDL is well above 4 or 5, well, the 150, like if your LDL is sitting at 5, if we give you a statin, we're going to drop it by 50%, you're still above 2.5, in which case we're going to have to give you another medication. And that medication is often Ezetrol or ezetimibe. It is 10 milligrams once a day with or without food, and it's dropping the cholesterol that you ingest in your GI tract by food. If the Ezetrol doesn't work and it isn't dropping you enough, the next one we're going to give you is either Lodalis. We probably will ask you to have more bran and fiber, or we would put you on an injectable called Repatha, in which case you'd be dropping your cholesterol by, it's every 2 weeks, and you'd be dropping your cholesterol by 65%. So if you are one of those genetically group people that are very high risk and every family member has heart disease and has had a cardiac event, you're likely going to be on that injectable medication, or you've had more than one heart attack, you're likely also going to be on that injectable medication as well. So Ezetrol is a fantastic medication. When added to statins, decreases your cholesterol by 75%. It is decreasing both your LDL, your bad cholesterol, and mildly increasing your good cholesterol, and very, very few side effects. It can be taken with or without food, used alone or with statins. Now, we're going to give ourselves another big stretch, okay? Big stretch. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. This is a new class of medications we're talking to now. We're talking about beta blockers that sit on your heart. So we had a little model of our heart here, and on your heart is receptors that are called beta receptors. The beta receptors work on adrenaline and controls your heart rate, the strength of your beat, and dilates blood vessels. Beta blockers are used in angina, they're used in high blood pressure, and in irregular heartbeats such as atrial fibrillation, and to prevent further heart attacks, so after you've had your heart attack. Now, beta receptors are all through your body. There's beta 1s in your heart, beta 2s in your lungs, beta 3s in your bladder. They're everywhere. So we want to use the beta selective blockers, and these are the ones that we normally use. Carvedilol is used in heart failure. Bisoprolol tends to be used by cardiologists. Sotalol, rhythm ones, are used by cardiologists. Propranolol tends to be used in migraines. Nebivolol is used by cardiologists, but there's a lot of alls. So the family of alls is your beta blocker, and these are going to affect your heart. When you take a beta blocker, so what I'm trying to explain to you is that once you've had a heart attack, it's like a brand new car. A brand new car after an accident, it is damaged. It's never going to work as well as that brand new car. So once that accident happens, well, we need the heart not to work as hard then. So the doctor will prescribe you after heart attack, or if you have heart failure, they'll prescribe to you a medication called beta blockers. So when that happens, the idea is you're squeezing the heart and the heart rate drops to around 60 beats per minute. It's that perfect heart rate. So for some of you, you've got that beautiful heart rate and blood pressure, and that's because you're on a beta blocker. Okay? This is not a medication that you can go on a holiday, say, I'm going on a drug-free holiday, that's it, I'm gone. I'm out of here, leaving all my medications behind, that's it, I'm on a holiday. Or you go on a holiday, the medications goes in the luggage, you land, you and the carry-on luggage are one way, and the medications in the luggage went another way. You have to take your medications with you, and it goes in your carry-on. The stewardess will argue with you, and you say, I'm a cardiac patient, my medications stay with you, and here's my report card and my list that says my medications go with me on the airplane. And they don't argue with you. As soon as you say you're a cardiac patient, you have no problems. Okay? So remember, this is not a medication you can stop suddenly. Even in some countries, such as Italy, where if you run out of the medication or you have a problem, if you go to a pharmacy, they will sell it to you because they realize it's not a drug of abuse. When you're put on a beta blocker or you're a cardiac patient, we get you to check your heart rate through your pulse, your radial pulse. If you're not very good at checking it, you can buy a cardiac polar heart rate monitor. So the polar heart rate monitor is more accurate than a Fitbit, and it's when your heart rate tends to go to 200 beats per minute, it's hard to catch your heart rate and calculate it. So if you're having atrial fibrillation, and this occurs maybe in the middle of the night, you put your polar heart rate monitor on, you look at the time, and you say, my heart rate's at 200 beats per minute, and then it was this way for 3 hours, and you can track it. So for someone with atrial fibrillation or someone who has problems catching their pulse, a polar heart rate monitor is very good. We happen to sell them here. They're about $100. It's not for everybody. If you can get your heart rate, that's fantastic, and you don't have atrial fibrillation, no problems. The beta blocker is going to cause you not to overexert. So if you go to the gym or if you start exercising and you just came home from the hospital, you're going to want that afternoon nap. And your spouse is asking you, what, are you depressed? Why are you going to bed? And you're going, well, I'm tired. I need a nap. I'm going to bed. So if you overexert yourself, you will get fatigued and you will stop exercising, but your heart rate will not go over a certain amount. So when they say target heart rate 150 beats per minute, well, you're never going to get there. You're just going to be exhausted and you'll say, I'm stopping. It is also a medication that causes you to have lightheadedness and dizziness. Sometimes you get vivid dreams or nightmares. So if you do get that, don't take your beta blocker at bedtime, maybe move it or a little earlier in the day, such as maybe dinner time, or if it's once a day, you can move it to morning. It may cause you to have some dry eyes. It may cause erectile dysfunction. Talk to your doctor or cardiologist if you're on it and you're getting those side effects. Beta blockers are used in caution with asthma. So you may have atrial fibrillation, but if you have asthma, because beta blockers can sometimes act on your lungs as well, it decreases the effectiveness of your asthma medication. So if you go to the cardiologist's office, remember to tell them, I have asthma. And if you have asthma, they may be able to use certain types of beta blockers, but not all of them. So they sometimes are not used with asthma patients or COPD patients. Now, on your heart, with those beta receptors that act on the contractility, act on the heart rate, but there are also calcium channels on your heart. And these medications that work are diltiazem and verapamil that act on your SA node and control your heart rate and act on the heart itself. But calcium channels also act on the periphery in muscles, such as amlodipine, felodipine, and nifedipine. So calcium channel blockers are used in angina, irregular heartbeats, high blood pressure. They work by affecting the movement of calcium into your heart and your blood vessels by slowing, because they're blocking calcium entering, they're slowing the heart rate, they're decreasing the strength of the heartbeats, and they're dilating blood vessels. That's why if you're a cardiac patient, oftentimes you're told, do not take calcium supplements. Calcium should be taken with food and ingested that way if you have osteoporosis or require it for different things. Unless you're a renal patient that requires calcium for maybe binding phosphate, and they are aware that you're a cardiac patient, you're often told not to take oral calcium supplements unless they're in a multivitamin. Calcium channel blockers are also medications where you can't stop taking it because you don't want to take it anymore and you're going on that drug-free holiday. You check your pulse if you're not feeling well. So if you're not feeling well, the three things you're going to check are your heart rate and blood pressure. And if you're diabetic, you're going to check your blood sugar. It's going to also cause you not to overexert. So you're going to feel tired before your heart rate goes up too high. Remember the side effects, again, because it's affecting blood pressure, are dizzy lizzy. You may want to start your first dose at bedtime. If you're getting too many side effects of lightheadedness and dizziness, you may want to space out your medication. So what do I mean by dizzy lizzy? When you lie down and you get up, sometimes the room spins or you don't feel quite steady. So what happens is, by this point, you realize I'm on 3 or 4 medications. She keeps listing off medications and all of them affect my blood pressure. So with that, sometimes you may feel a little lightheaded and dizzy. Space out those medications. And the easiest way for you to prevent that is by lying down, sitting up, sitting for a couple of minutes before you head off to the bathroom. And then that lightheadedness or that postural hypotension doesn't seem to affect you as much. This medication can cause you to get some tiredness. The amlodipine, felodipine, and nifedipine can cause some headache or some swelling on your ankles, feet, and lower legs, and sometimes some swollen and tender gums. So if that does happen, mention something to the doctor, cardiologist, or your pharmacist. New class of medications completely. We are now talking about water pills. It's easy. You know you're on a water pill. Why? You're going to the bathroom more often. So there are 2 major classes of water pills. There are potassium wasting, hydrochlorothiazide or HD added to a medication, or CD, that tends to cause you to pee more, and you take these medications in the morning. Lasix or furosemide are used if you have heart failure. Indapamide or metolazone tend to be used if you see a kidney doctor or nephrologist. Spironolactone or pleromone tend to be used if you are a heart failure patient, so they can be alone or in combination. They're used in high blood pressure, or if you have swelling or lung congestion, such as congestive heart failure. What are they doing? They're pushing out water from your body by increasing your urine flow. So when do you take your first dose? because you are going to be the person that if you take it later in the day, you're up all night peeing. So the idea is you take your first dose in the morning and your second dose maybe just after lunch, but you try to take it earlier in the day so you're not up all night peeing, and you tend to decrease your volume of fluids into you later in the day so you're not up all night peeing. You take it with food to prevent an upset stomach. It can cause, again, it affects blood pressure, so it's going to cause you to feel a little lightheaded and dizzy and tired. You will get blood work done with this because it does affect some electrolytes, but this medication is going to cause you to sunburn. So for all those gardeners and those golfers out there, those people who go on holiday to Florida, not during COVID, of course, but if you go on holiday and you go to bright sunny Florida or you go outside, you may not have sunburned before, but you're going to sunburn now. So sunblock and a hat when you're out in sunshine, when you happen to be on a water pill. So when you pee, you're also pushing out potassium. And what are your signs of extra potassium loss that you may need to go on supplements for potassium? You may have dry mouth, increased thirst, irregular heartbeats, mood changes, or muscle cramps and pain. Now, mood changes, your spouse is going to say to you, "What's biting you?" And I say this in the kindest way because they actually do care. So if someone asks you that who knows you well, I use that example about the family member of mine that was diabetic and that would once in a while just throw out the strangest comment. And that you could have mood changes if your potassium's low or if your blood sugar's low. And sometimes you don't actually sense it, but you're just irritable. And so the easiest thing for them to do is actually just give you a small glass of orange juice or give you a small thing of juice. And when that happens, your potassium comes up and your blood sugar comes up and you're back to normal again. So keep in mind, if someone's saying to you, "What's biting you and why are you cranky?" Not during COVID, of course, it means that they actually do care and that you may not be sensing low potassium. Now, potassium supplements, oftentimes water pills are given with ACE inhibitors because the water pill lowers your potassium and the ACE inhibitor increases your potassium. So that way you're back to normal again. But when you take potassium supplements, you take with food, you avoid salt substitutes. But when you talk about using with high blood pressure, don't use salt substitutes, use lemon. So we say lemon all over the food to give you that salt taste. But watch if you have black tarry stools, heaviness in the legs, tingling of hand and feet, severe stomach pain or confusion or nervousness, that maybe your potassium's too high. Now, only some of you would be on antiarrhythmics and may have some rhythm issues, and that's why you're seeing a cardiologist. So I'm trying to watch the time, and we're doing very well for time here. We'll have lots of questions for answering, lots of time for answering questions. But antiarrhythmics require you amiodarone, dronedarone, digoxin, propafenone, and sotalol. They require you to take your medications every single day at exactly similar times. So set an alarm on your clock, on your phone or your watch, or better still, associated with meals so you don't forget, or you carry a blister pack, and some pharmacists will sell it to you. Some pharmacists will give it to you for free if you're on a lot of medications. And if you happen to be like me, I'm awful at remembering to take medications, but if you have a blister pack and you look at it and the dose is still there, well, I guess you didn't take it. But if you have a blister pack, remember to keep it in a higher shelf so that little kids don't get into it because it looks like little candies. So the idea is antiarrhythmics. Remember the first drug I said a pharmacist gets kind of worked up about is Coumadin. Amiodarone is the second one they get worked up about. So antiarrhythmics are used to change irregular heartbeats back to normal sinus rhythm. Digoxin is a pretty little flower, but it is also used to strengthen the heartbeat. It's used in heart failure and rhythm disturbances, and it's acting to relax the overactive heart, and so that the SA node, the pacemaker cell, is the one that's supposed to be there, and that you have a normal heart rate. And it's increasing the pumping effectiveness of your heart by having it beat more regularly at that 60 beats per minute. You don't get to stop taking your antiarrhythmic just because you don't want to take it. So you have to remember not to avoid doses, and you have to see your doctor regularly. That you may have to get some blood work done, and you don't get to take any medications off the shelf or extracurricular medications because they can interact. It's often a good idea to check your pulse, and if you are not good at checking your pulse, get that polar heart rate monitor so you can know what your heart rate is at all times, and you know what your target heart rate is. Now, digoxin is one of those drugs, great with a narrow therapeutic index, fantastic, but what happens is they will have you do blood work after you start digoxin, and typically you'd get that blood work done 10 hours after you take your dose. So if you're not feeling well, you have symptoms of nausea, vomiting, and diarrhea, and you happen to be on digoxin, well, you may want to get your blood work done. So if you have loss of appetite, changes in vision, such as blurring, color changes, but seeing halos. So if you're looking at the sun and you see that big shiny thing around it, but you're looking all around and you're looking, okay, well, normally I'm not looking at the sun and I'm seeing these halos. You want to get your blood, you want to get your blood work done and check your digoxin level. Also, if digoxin is affecting your heart rate. So great if your heart rate is in the 60 beat per minute. Great if your heart rate is in the 50 beat per minute if you're not symptomatic. If your heart rate happens to be in the 30s, well, that's a problem. For every 2 seconds, we have one little contraction, which means you feel like passing out. So if you feel like you're passing out, you want to check your heart rate as well. And that's one of the things, that's why we have you wear a Holter monitor and we check to see if you've had any rhythm disturbances. Now, before we get to vitamins, we're going to talk about vaccines. And this is a big contentious issue because everybody has strong ideas about whether they should get a vaccine or not. And we're not talking about the COVID vaccine right now. We're talking about just the general flu vaccine. And the answer is, if you're a cardiac patient, if you have a chronic disease state such as diabetes or asthma or any sort of chronic disease, you absolutely must get the flu shot. Why? Because if you have heart failure, what happens is that your normal zone is, you're like an egg. If you're in your happy little normal zone, you do well. But if you get the flu and your fluid status changes, that could push you to having a cardiac event or push you to a hospitalization. So oftentimes, cardiac patients are the most fragile. You decrease your chances of having a cardiac event by up to 30 to 50% if you get the flu shot within a year of having a cardiac event. So you are the first person lined up to get your flu shot. And after your flu shot, then you get your COVID shot, because it is absolutely imperative. You would not do well with getting the flu shot. You may precipitate another cardiac event or a hospitalization. So keep in mind, what is a flu shot? Well, they have multiple variations of what they think the flu is going to be. And they usually have 3 or 4 different types of strains of flu. And they estimate what they think it is. So they have different types of flu shots, and they're based on the N, the H factor, and the N factor. So if you think of the H factor as being a hat, so it could be the pink hat and the red sunglasses, but then you see a flu that has the blue hat and the purple sunglasses, you still recognize it as being a flu. And because you've seen it, you've got memory cells, and your version of the flu is much milder. So the idea is you can handle it a lot better, and you will not get as sick because you've got memory cells, not just your fighter cells, but your memory cells kick in. And that's why it's so important for you to get the flu shot. Now, even if you don't have the right version of it, you will still do better. There are 2 different flu timings of when you get the flu shot. So there was 1 year that the flu shot was only 10% effective. That was the December to January strain. But the one that occurred in the end of February and March, 100% effective. So typically flus happen twice a year. Now with COVID, everybody wearing masks, not a problem. A lot less flu, a lot more hand washing. So how you prevent the flu from happening is you don't touch your face, and you constantly wash your hands when you're out of the house, and that prevents that face. So sort of hand to face motion, and that's how you're introducing the flu to yourself. So hand washing is key. It is very, very important, even more important than hand sanitizer. If you can't wash your hands, then go to washing, then using the hand sanitizer. And your typical rule of thumb is, if you're out in public, at least every 1 hour you're washing your hands if you're a cardiac patient. So remember, if you don't understand why it's important for you to get the flu shot or your COVID shot, please talk to your specialist, talk to your pharmacist, and see, is it right for you? So now we start talking about vitamins. Keep in mind, we can have a 1 hour conversation on just vitamins. And for the sake of this talk, we're going to narrow it down, and my focus is going to be vitamins and basically, do I need to take it if I'm a cardiac patient? And the answer is probably just a general multivitamin would be adequate. So a general multivitamin has a lot of things in it, but one multivitamin is perfectly fine. And that's because a lot of adult Canadians do not, or seniors do not get enough vitamin B12. So if you take a general multivitamin, it's going to have most of the basic things in there. But vitamin A doesn't have any proven benefits in heart disease, and the answer is no. So no extra vitamin A for you if you're taking it for heart disease. Vitamin B complex and folic acid. It's actually very well studied. And what they found is that there's a hormone that is elevated if you have heart disease called homocysteine. And so they discovered this hormone, and it's reduced if you take high doses of vitamin B complex and folic acid. So high doses of B vitamins, which are peed out every single day, and folic acid, which is peed out every single day. So I have to take it every single day. The hormone was reduced. So they did a study and they found out, well, reducing the hormone doesn't reduce your risk of heart disease. And the answer was no. So vitamin B is usually very beneficial if you have certain types of B deficiencies. And if you have anemias, the doctor will take you to tell you to take some doses. But some women will swear they get increased energy if they take B vitamins, and sometimes they take it. So if you have low energy and you feel like you just want to take it, ask your doctor or pharmacist if you can take B vitamins. But remember, you have to take them daily. Vitamin C, 1 orange, perfectly fine every single day. But taking 7 doses, 7 vitamin C tablets, some people will swear to you, it works amazingly well to prevent my cold. It does change the pH in your urine, and it could cause you to excrete drugs differently. So we strongly suggest do not take any extra vitamin C than just taking a general multivitamin or an orange juice. In extreme athletes like Olympic level or maybe Navy SEALs, it does decrease your chances of developing a cold, but we are not that level. All of us are working towards that perfect body of ours that was maybe when we were 18 years of age. Vitamin D, useful because we do not produce as Canadians enough vitamin D, and that's why it's added to milk and other products. So in North America, we do not produce enough vitamin D from just the sunshine. So some doctors, specifically a family doctor, will recommend 1,000 to 2,000 units a day. And that's usually for other chronic disease states, such as depression or other mood disorders or other things, or maybe osteoporosis. There's many reasons to use vitamin D. And even in COVID, they found that vitamin D, taking your statin and metformin, may decrease the severity of. There's something to be said that perhaps there's some benefit in preventing a worsening of your COVID if you get exposed to COVID, but those studies are not definitive. But certainly taking vitamin D is beneficial in a North American climate, and a lot of people are taking it. Ask your family doctor if you need to take it. Vitamin E does interact with Coumadin. It will interact with blood thinners. No additional proven benefits. It was thought to be an anti-inflammatory and a free radical scavenger. So there was at one point they thought you should be taking it. It is used for cuts, oftentimes to maybe prevent scars and things like that, but there's no proven benefit. Do not take any extra vitamin E. Green tea. Green tea actually has the highest caffeine, and that's why it's often recommended to take in diets, because they want you, the lower calories may cause decreased energy, increase your green tea, and increases your heart rate. but you're taking your beta blocker. So green tea will interact with other medications, and some medications, some beta blockers are actually reduced by 80% effectiveness. So no green tea with you, but black tea, herbal teas, Earl Grey, all of those things perfectly normal. Mint tea, all perfectly fine, just no green tea. Because the idea being we want to lower your heart rate if you're a cardiac patient, so no Red Bull and green tea and all of those things, because those are just increasing your heart rate. Grapefruit interactions do occur with many medications, so we want you to give up the grapefruit, perfectly fine for you to have the oranges and other things. Those are perfectly fine. There's no drug interactions. And remember, ask the dietitian tomorrow about any food questions that you do have. She's great at answering questions, so I strongly urge you to ask questions tomorrow about the dietary parts of it. Coenzyme Q10. Well, if you are an achy person and you have a lot of side effects to statins, the doctor's going to tell you take coenzyme Q10. Why? They absolutely want you to stay on your statins. So typically you produce more than enough coenzyme Q10. You do not need to go out and buy Qanol or whatever's on TV. But if you start complaining about achiness, the doctor will say take 200 to 400 milligrams of coenzyme Q10. But some people, it will let them continue on their statin. But every time you complain about achiness, the doctor drops your statin dose. And remember, the statin is preventing your cardiac events from happening. So you really want to be on your statin. And finally, Martha and Bob live in the same house. Martha and Bob don't want to pay the pharmacist their dispensing fee, but they're all both on the same beta blocker. So Bob takes twice the amount of beta blocker and Martha doesn't seem to take any. Do not share your medications. The pharmacist is tracking and looking at compliance, and they're sending the doctor notices. Bob is using it at twice the pace, and Martha doesn't seem to be taking anything. So don't share your medications. Keep a medication card, and I do have a list here of medications. A simple Excel spreadsheet. Hold on a second. A simple Excel spreadsheet, certainly in your. Oh, I don't know if you can see this. But an Excel spreadsheet or one that's on your blister pack is fantastic. Why? Because it's a great typed sheet and you can adjust it, and then everyone knows what medications you're on. You may want to carry a medical herb bracelet because you can call them and tell them. You don't have to have it all typed on that medical herb bracelet. But people want to know what medications you're on. And certainly if you had your family, if you were unresponsive and your family had to say what medications you're on, they have no idea. So keep a list in your wallet or this thing, certainly of your medications or your cardiac condition. Tell your doctor, pharmacist, and all your doctors about all the medications you take, the prescription, the non-prescription, the extracurricular, the over-the-counter, the herbal, everything. Now, we do need you to tell us if you're using marijuana, because marijuana can cause, very rarely, sometimes heart attacks or strokes, because transiently it does increase your blood pressure and heart rate. So please discuss that with us. We did have a patient stop taking all their pills, use cocaine, and then come to cardiac rehab and pass out on us. So please tell us every medication you're on, any of them, even if they're extracurricular, we do need to know. And tell us if you are having problems with them, or tell your pharmacist before stopping anything so that we can find a proper medication for you. Participate in non-drug options. It doesn't mean that you get to stop medications. And I'm going to tell you a very, very important thing. Medications work if you take them. Seems very intuitive. But if I was to tell you that 50% of patients, now it may be in the US, it may be in Canada, 50% of patients stop taking their medications one year after having an event because they just don't see the point. I've survived my heart attack. What do I need these for? Well, the medications are preventing you from getting your next heart attack and helping you maintain your heart and helping your pump recover. So it's so important that before you stop taking medications, you talk to your doctor or pharmacist. Go to one doctor or pharmacist so they can track for drug interactions. Be aware that there are food, drug, and alcohol interactions. take your medications and prescribed, and don't stop taking them without talking to somebody. Check with your pharmacist before you buy any over-the-counter medications. I'll give you the example of the patient that says, well, I saw this commercial that said they took Neocitrin on TV and they slept very well after they had a really bad cold, so I took it. Well, it can increase your blood pressure through the roof. So you can end up precipitating a stroke if you have high blood pressure. So you may end up with the blood pressure of 180 on 100. So if that happens, you need to check with your doctor or pharmacist. So keep in mind, you don't get to take anything off the shelf that says decongestant or whatever. Your pharmacist has to tell you what you can take, or your doctor. Don't use any expired medications. If you stop taking a medication, especially prescription medications or pain medications, take them back to the pharmacy to incinerate them. A lot of youth do take medications out of cabinets of family members and abuse them. So we caution you to don't become a pharmacist in your own cupboard at home. Just try and take them back so that they incinerate them. And I'll use a story. They say the fish in the ocean are becoming more female because females, when they pee out active birth control pills and active birth control. So it goes right into they pee it out, it goes right into the toilet, and it goes into the water system, and it ends up in the ocean. And they say the fish are becoming more female. The idea is if you flush something down the toilet, or if you throw it into the garbage, it's getting back into the water system. Pharmacists are not going to lose their license by redispensing medications. So please take them back. They will incinerate them. Don't bring them to our office because we're not a pharmacy. Take them back to your pharmacist and just say, I'm not on these medications. Can you incinerate them? And they'll be happy to do it. Keep your medications in your compliance aid or prescription or your pill bottles. Remember, if you're going to emerge, to take all your medications with you. And the very last slide I have. Doc, I've been on these big bag of meds after I had my heart attack, and I've been really good at taking them for 1 year, but let's talk. Some of these need to stop. I've been doing really well. So if you take one medication for at least 1 year, you've decreased your chances of dying to 5%, to 29% or 30%. If you take 2 pills, you're down to 15%. If you take 3 pills, you're down to 10%. And if you take 4 pills, you're down to less than 5%. So what are the life-saving medications till death do you part, not your marriage? They are, remember I told you to put up your hands? They are the statin. They are the ones that end in they end in the statin. The second one is the ALS or the beta blockers if you've had a heart attack. The third one is the ACE inhibitor or the angiotensin receptor blocker, which is the Prils. And the fourth one happens to be your blood thinner, the aspirin, or one of those blood thinners. These are the medications till death do you part, not your marriage. And at this point, we're going to stop, and I will be happy to answer questions.